The Cancer Australia statement, Influencing Best Practice in Breast Cancer, provides the evidence to support effective patient-centred cancer care and improve cancer outcomes. The statement is based on the best available evidence, supported by expert clinical and consumer advice.
Even though I completed all my treatment for early breast cancer some years ago, I still live in fear that it's going to come back. I know that an annual checkup and mammogram or ultrasound is important, but it's still hugely tempting to ask my specialist to conduct every test under the sun, just to be certain that any recurrence is detected as early as possible.
Tempting? Yes. But for a woman who's been treated for early breast cancer and who has no symptoms, there is no evidence that intensive follow-up testing, such as blood tests, chest X-ray, CT, PET, or bone scan, has any benefit in detecting recurrences or increasing survival.
In fact, these extra tests may actually cause harm by exposing patients to unnecessary radiation, invasive procedures, and anxiety.
Please, don't give us tests that we don't need and that could cause harm.
Standard follow-up after early breast cancer in patients who are not experiencing symptoms involves taking the patient's medical history, doing a clinical breast examination, and performing an annual mammogram and often an ultrasound too. In these patients, more intensive tests are not appropriate.
For more information on the Cancer Australia statement and key appropriate and not appropriate breast cancer practices, visit canceraustralia.gov.au.